Your heart might be in danger, but would you even know? Every second of every day, your heart is working tirelessly to keep you alive. Right now, as you're watching this video, it's pumping blood through an incredible 60,000 miles of blood vessels in your body. But what if something's wrong? What if your heart is desperately trying to warn you, and you're not noticing the signs? Most of us think heart problems come with dramatic chest pain, sudden collapses, or the sharp stabbing pain we've seen in movies. But here's the terrifying reality. Heart damage often starts silently, creeping up with no obvious warning signs. By the time the classic symptoms appear, significant damage may have already been done. And here's what's even scarier. Heart disease doesn't discriminate. You might be young, exercise regularly, and feel perfectly healthy, but your heart could still be at risk. Factors like chronic stress, hidden inflammation, poor sleep quality, and even seemingly unrelated health issues could be silently harming your heart right now without you realizing it. That's why today's video is so important. We're about to reveal 9 unusual and often overlooked signs that could indicate serious heart problems. These aren't the typical warning signs. You won't hear about these in most health checkups. Your body is sending distress signals long before a crisis hits, and recognizing them today could literally save your life tomorrow. Number 1. Skin rashes or unusual spots. When we think about heart health, we rarely consider our skin. But did you know that chronic skin conditions like psoriasis or eczema could be linked to heart disease? Both of these skin conditions are caused by inflammation, and inflammation plays a significant role in the development of atherosclerosis, the hardening and narrowing of arteries due to plaque buildup. People with psoriasis are at a higher risk of heart attacks and strokes because their bodies stay in a constant state of inflammation, which doesn't just affect the skin, but also the heart and blood vessels. What your skin could be telling you about your heart. If you've been dealing with persistent rashes, red patches, or scaly skin, especially if they don't seem to improve with treatment, it might be time to look at the bigger picture. These skin issues may seem isolated, but they could indicate underlying cardiovascular problems. What should you do? The best course of action is to consult with both a dermatologist and a cardiologist. Managing inflammation through a healthy diet, stress reduction, and proper medical care can help protect both your skin and your heart. Your body often sends subtle signals when something isn't right, so don't ignore what your skin might be trying to tell you. Number 2. Sudden or excessive sweating. Breaking out in a sweat during a workout or on a hot day. That's completely normal. But what if you start sweating profusely for no clear reason, even while sitting still? That could be a serious red flag from your heart. How heart issues cause excessive sweating. When your heart is struggling, it triggers the body's fight-or-flight response, releasing stress hormones that can cause excessive sweating. Cold, clammy sweating, without exertion, can be one of the first warning signs of a heart attack, especially when combined with other symptoms like chest discomfort, nausea, dizziness, or shortness of breath. Why you shouldn't brush it off. Many people dismiss this as being overheated, anxious, or maybe just coming down with something. But if you experience sudden, unexplained sweating, particularly if it's accompanied by pressure or tightness in your chest, don't wait. Seek medical help immediately. Time is critical when it comes to heart attacks. If something feels off, trust your instincts and call emergency services right away. Recognizing this symptom early could be the difference between life and death. Number 3. Unusual or prolonged anxiety. Feeling anxious before a big event or during stressful situations. That's totally normal, but what if you're experiencing sudden, intense anxiety or panic attacks for no clear reason? Your heart and nervous system are closely linked. Conditions like high blood pressure, irregular heart rhythms, arrhythmias, and poor circulation can all trigger anxiety-like symptoms, including racing heart, dizziness, and shortness of breath. In some cases, persistent or unexplained anxiety may actually be an early sign of heart disease. Don't ignore these symptoms. Many people mistake heart-related symptoms for panic attacks, especially women, who often experience anxiety, nausea, and fatigue as early signs of a heart attack instead of the classic chest pain. If your anxiety feels unusually intense, happens suddenly, or is accompanied by heart palpitations, sweating, or chest discomfort, don't ignore it. Take action for your heart health. Monitor your symptoms closely, reduce stress through meditation or deep breathing, and most importantly, get a heart checkup. Your body might be signaling a deeper issue, and catching it early could protect your heart health in the long run. Remember, don't dismiss anxiety. it might be more than just in your head. Number 4. Sudden extreme weakness. We all feel tired from time to time, but what if you suddenly experience overwhelming weakness out of nowhere? Not just regular fatigue, but a crushing exhaustion that makes even simple tasks seem impossible. This could be a serious warning sign from your heart. Why does sudden weakness happen? When your heart isn't pumping blood efficiently, your oxygen levels drop. This can cause your muscles and organs to struggle, leading to sudden extreme weakness. Often, this is accompanied by shortness of breath or chest discomfort. Many people dismiss this as just being overworked or dehydrated, but it could actually signal a heart attack in the making. How to spot the difference between regular fatigue and heart-related weakness. Unlike regular tiredness, this kind of weakness comes on suddenly and doesn't improve with rest. It may feel like you've hit a wall, even when doing something simple. If you experience chest pain, dizziness, or nausea alongside this sudden weakness, don't wait, call emergency services immediately. Fast action could save your life. Number 5. Snoring or sleep apnea. Do you or your partner struggle with loud snoring at night? While it might just seem like an annoying habit, persistent snoring could be a sign of something much more serious, sleep apnea. And if you're experiencing breathing pauses along with snoring, it's even more concerning. What is sleep apnea? Sleep apnea is a medical condition that occurs when your airway becomes partially or completely blocked during sleep, causing frequent interruptions in your breathing. Each time your breathing stops, your oxygen levels drop, forcing your heart to work overtime and raising your blood pressure. Over time, this cycle can lead to serious health issues like high blood pressure, heart disease, and even stroke. How does sleep apnea affect your heart? With sleep apnea, your heart is under constant stress. The repeated drops in oxygen levels cause your heart to work harder, leading to increased blood pressure and strain. If left untreated, this can significantly increase your risk for heart problems. Signs you might have sleep apnea: loud snoring, breathing pauses during sleep, daytime fatigue, morning headaches, difficulty concentrating, frequent waking at night. Additionally, maintaining a healthy weight can help reduce the severity of the condition. Ignoring sleep apnea doesn't just affect your sleep, it can put your heart at serious risk. So, if you're dealing with loud snoring or constant fatigue, take action now and get checked out. Your heart will thank you later. Number 6. Unexplained nausea or indigestion. We've all experienced an upset stomach at some point, maybe from something we ate, stress, or a minor digestive issue. But what if that persistent nausea, bloating, or stomach pain isn't coming from your stomach at all? What if it's actually a warning sign from your heart? How heart issues can affect your digestive system. When your heart struggles to pump blood efficiently, it can impact your digestive system, leading to symptoms that mimic acid reflux, indigestion, or even food poisoning. Many people, especially women, experience nausea and stomach discomfort as some of the first signs of a heart attack. Because it doesn't always come with chest pain, it's often brushed off as something minor, until it's too late. When to take nausea seriously. If your nausea feels unusual, lasts longer than expected, or is accompanied by dizziness, shortness of breath, or discomfort in your chest, jaw, or back, don't ignore it. This could be your body signaling an emergency. Call for medical help immediately. Number 7. Decreased tolerance for exercise. Do you find yourself getting winded more easily during activities that used to feel effortless? Maybe climbing stairs leaves you unusually short of breath, or a simple walk feels exhausting. If so, your heart may be struggling to keep up. Why decreased exercise tolerance can be a heart problem. When your heart weakens, it loses its ability to pump oxygen-rich blood efficiently, leading to fatigue, dizziness, and shortness of breath, especially during physical activity. What might feel like just being out of shape could actually be a sign of progressive heart disease. Don't brush it off, this could be serious. Many people ignore these early warnings, assuming they just need to exercise more or blame it on aging. But a sudden drop in exercise tolerance is not normal. It could signal heart failure, blocked arteries, or other serious cardiovascular conditions. What should you do? Don't push through the exhaustion. If you notice a decline in your stamina or feel unusually weak during routine activities, consult a doctor immediately. Catching heart problems early can help prevent serious complications like heart attacks or strokes. Listen to your body. If exercise feels harder than it should, it's time to check on your heart. Now that you know the warning signs, here are some simple steps to protect your heart, eat heart-healthy foods, focus on whole grains, lean proteins, healthy fats, like omega-3s, and plenty of fruits and vegetables. Cut down on processed foods, trans fats, and excess sugar that contribute to inflammation and artery blockage. Exercise regularly, aim for at least 150 minutes of moderate aerobic activity per week, like brisk walking, or 75 minutes of vigorous activity, like running or cycling. Exercise keeps your heart strong and your blood vessels clear. Quit smoking and limit alcohol. Smoking and excessive drinking put enormous strain on your heart. Quitting smoking can immediately reduce your risk of heart disease, while moderating alcohol intake helps maintain healthy blood pressure. Manage stress effectively. Chronic stress triggers inflammation, high blood pressure, and irregular heart rhythms. Practice deep breathing, meditation, yoga, or other relaxation techniques to keep your stress levels in check. Get regular heart checkups. Don't wait until symptoms appear. Routine blood pressure, cholesterol, and heart screenings can detect problems before they become life-threatening. If you found this information valuable, please give it a thumbs up, share it with someone who might need it, and subscribe to our channel for more life-saving content. Your support helps us spread awareness and empower more people to take charge of their health. Thank you for watching.